and welcome to yet another episode of Tablet. In this episode, we have with us Dr. Sheela C Babu, who is a gynecologist. Let us welcome her to the program. Welcome, doctor. First of all, we would like to know more about you.
About me, I am very proud to say that I am a student of Trivandrum Medical College. I did my MBBS, MD, DGO from Trivandrum, and I had my professors right from undergraduate to postgraduate. After that, I joined the health service, and there I first appointment was at Alleppey. I had to go even after completing. I joined the service only after my post-graduation, but I had to work in the school health program. So I am very much attached to students of the school. 3 years of my first years of my career were with the school students of government schools. After that, I joined the postpartum program unit of Alleppey Medical College. I spent 2 years there. After that, then I was transferred to the Women and Child's Hospital, where again I had to continue with my family planning program as well as the obstetrics and gynec. That was a hectic period, but I'm looking back, I'm very satisfied because I could do so much of work during those days, because every month I have to travel right from one end of Alleppey district to the other end, from the southern end to the northern end, and conduct 8 camps per month. And mind you, after my camp, when I returned home by 7 o'clock, I have to join the duty from 8 p.m. and whole night. You can imagine a women and children's hospital which had much more deliveries than the Alleppey Medical College those days. That is from 92 to 97 and 2000. I had to work and I had to continue with my camps, and camps means sterilization camps. Each camps will have 30 to 35 operations, mini lab as well as lapro camps. After that, then we thought it is too hectic, and we went to Trivandrum, and I joined again to my old alma mater, and again I was really blessed to work in my own medical college. But as a health service doctor, I had to work in the PP unit, family planning unit. I spent my 6 years, and it was wonderful because all my friends and teachers were there, and they even gave me opportunity to teach the medical students, the final year students, and also all the other year students there, and also I had the opportunity to train the postgraduates in laparoscopy. All were rewarding. Even if I was in the health service, I had the opportunity like a medical college teacher there. After that, then I was transferred we had to settle down at Ernakulam. My husband also retired from Trivandrum Medical College as a professor of orthopedics. He joined Amrita, and I had to come back and join General Hospital Ernakulam. General Hospital, I worked from 2007 to 2013. I worked there and retired in 2013, and I joined Ernakulam Medical Center.
Ma'am, we have received some questions from the viewers, mainly from UAE. So we will move on to the questions now.
Okay.
First mail is from Anjali from Dubai. What is the appropriate amount of weight gain during pregnancy, and is it safe to exercise during pregnancy?
Appropriate weight gain depends upon your BMI. If you are having a normal weight, that is BMI of 23, you have to gain 10 to 12 kilograms only. Suppose if your BMI is above 23, suppose you are having it is above, you are not to gain that much of weight. If you are, for example, if you are 86, you need gain only 4 to 5 kilos. Don't be afraid. Your child is going to gain the appropriate weight during the 10 months of pregnancy, even if you don't gain weight, if you are obese. So that is a false conception among all. If you are obese also, you are going to take a lot of food and you are trying to gain a lot of weight and all this. There are so many complications associated with obesity. And mind you, you can be very sure and take into confidence, you need gain weight only according to your BMI. If you are obese, you need gain total 10 months, even maybe 4 to 5 kilo, that will do. And the baby is not going to get affected.
The other question that she has asked is, what are the fetal movement counts, and is it safe to use insect repellent while pregnant?
Regarding exercise during pregnancy, walking is the best aerobic exercise. You can do many exercises, but only with the advice of a gynecologist. There are so many exercises which we can help you out, which there's no time, does not permit me to tell you, and also moreover I have to demonstrate also.
The other thing that she has asked is, what are the fetal movement counts?
Fetal movement counts per day you are appreciating after, maybe you appreciate early, but that it is not that significant. But after 5 months, 6 months, you can appreciate the fetal movements. Whenever you take food, you can get a fetal movement. 4 times in a day, if you appreciate movements while you are taking food, then that will be okay. Then the rest will be, we will manage by, we'll be seeing, we'll be examining you and find out, and also by ultrasonogram we can confirm your fetal movements and well-being of the baby.
Okay. Is it safe to use insect repellent while pregnant?
Try to avoid all chemicals, even through your skin absorption will take place. So avoid all chemicals. Already we are in a fully contaminated world, so don't add on to.
Is there any relief for restless leg syndrome? And may I eat cold cuts or lunch meat during my pregnancy?
See, regarding leg cramps, there are so many causes for your leg cramps. So we'll have, calcium deficiency can lead to pregnancy. Usually is water retention. Water retention can irritate the nerves. That can also cause problem. We'll have to examine. You must get the advice, and we will have to be examined by a gynecologist to arrive at a conclusion.
And lastly, what can I do about constipation?
Constipation, pregnancy hormone like progesterone, it is a constipator because the bowel movements are reduced by progesterone. Progesterone also reduces the contraction of the uterus and relaxing it such that the baby can be held in the uterus during the 10 months. Similarly, the same effect is on the intestines also. So you can expect constipation. What we have to do is take fruits in large amounts and also salads. And also early morning, it's a very effective, simple way. Take in your fasting stomach, you take 2 to 3 glasses of warm water. That itself will give you the stimulation to purgate. Then there are so many safe medicines which we can prescribe to you.
Okay. Now moving on to the next mail. It's from Anamika from Kofakan. What do I do if I missed 1 or 2 days of birth control pills? And is the patch safe?
If you can afford to, if it is a combined pill which you are taking throughout the month, you can afford to miss 1 pill. But as soon as you get reminded of the pill, you take it. Suppose you have forgotten 1 pill yesterday night. Tomorrow morning you're reminded. So you take the pill in the morning. If you are reminded in the noon, take it in the noon. If it is evening, evening. If it is the next night you are remembering, take 2 tablets that night. You can't afford to forget 2 tablets. Then what you can do? You must do additional backup methods like condoms will have to be used because you may get an ovulation. Ovulation will not be prevented. So there's no harm. You can continue taking the pill and also a backup method like condoms.
Okay.
Regarding the patch, if you follow the instructions, it is effective and safe. But the thing is that the patch, if you are sweating a lot, the patch may get detached. That is the only defect in using the patch. The patch has all the side effects of an oral contraceptive pill. That's all. The benefits and the side effects of all the oral contraceptive pills.
Can I have a pap smear if I have my period?
Never. Pap smear always has to be taken only 10 days after the periods.
I have gone through menopause, but I'm experiencing spotting or staining. What should I do?
Definitely, this is the time to visit a gynecologist. You must get thoroughly examined by her because you should never get a bleeding or staining after attaining menopause. That has to be investigated. It may be very rarely, you may not have any serious problems, but it is very important that you get investigated.
What should I do if I think I have vaginal infection or a urinary tract infection?
Vaginal infection and urinary infections are common during pregnancy and otherwise. You can get easily treated by visiting a gynecologist.
Okay. Now moving on to the next mail. It's from Deepika from Abu Dhabi. I had a hysterectomy a few years ago, and every once in a while I see blood. Not like a period, just a small amount, but it is blood. Is this something that I should be worried about?
No, not much. It may be a simple reason. You can visit a gynecologist. It may be the healing granulation tissue or some pathology, whatever it is. Only a gynecological examination can reveal what it is.
Okay. I'll be 42 years old this September. Recently, within the past 2 years, I feel that I have become symptomatic with PMS. In the past, I never experienced symptoms such as cramping, bloating, or mood swings. Can this be attributed to my age?
Yes, maybe you are going in for a premature early menopause. You can visit a gynecologist and get relieved of these symptoms.
Okay. I also have had a definite decline in libido. Please advise.
What is your age? I do not know. Whatever, there are so many solutions. We'll have to, again, you can visit a gynecologist and you can get relief of these symptoms.
So now moving on to the last mail is from Mona from Align. What can I do about nausea and what medications can I take for?
Nausea, is it during pregnancy? If it is during pregnancy, there are so many medicines which are safe in early pregnancy. You can just meet a obstetrician and gynecologist.
Can I exercise and what should I be eating?
Definitely, pregnancy is not a condition to be in the bed or anything. You can carry on all your daily chores. Only thing, it should not be heavy. Exercises are also the best exercise which I can tell you from here is walking, aerobic, best exercise. And also upper body exercise is all you can do. That is safe even without me. I cannot demonstrate all the exercises, but upper body exercise like your head exercise, your arms, all that you can do. All the rest you have to visit a gynecologist. She will guide you.
How do I know if my baby is moving enough? And what is the AFP?
Regarding food intake, you must definitely take lots of water. The water cleanses your body. So you have to take 2 to 3 liters of water, fresh vegetables, and remind you, not any fried items and sweets. Definitely you have to cut down on sweets and fried items. Take fresh fruits. Take fresh fruits, enough of vegetables, pulses. Definitely pulses will add to your protein. You must take 1 egg a day throughout your pregnancy and lactation. You must take 1 egg because 1 egg will provide all the necessary, at least the minimum necessary protein which is needed by your body. Then balanced diet. Take not much of carbohydrate and fats.
How do I know if my baby is moving enough?
Baby, sometimes it goes to sleep also. If your baby moves when you take your diet, that is the time when the baby gives a movement. That if you can appreciate movements after you taking food 4 times a day, then that is sufficient.
What test do I need if I'm over 35 years old?
Just 35. If you are more than 35 years, definitely all screening has to be done prior to pregnancy. You have to plan a pregnancy. If you are 35 years, see that you test your thyroid, your blood sugar, your hemoglobin, your urine, your weight. Very important. Your BMI has to be maintained. Only then go in for a pregnancy. You are a candidate to develop gestational diabetes, blood pressure, etc. And also your baby, you have to screen during pregnancy. You have to, mind you, you take folic acid 3 months prior to pregnancy to avoid any congenital defects. Again, regarding chromosomal, you can't find out. So you have to do your ultrasonogram soon after at 6 weeks of gestation. Then at 12 weeks to rule out a mongol. By 12th, between 11 and 13 weeks, if you do a anomaly scan, we can rule out any birth defect like a mongol. Then next, you have to do triple marker test. That is a blood test. Triple marker, quadruple marker test are there to test between 11 and 13 weeks. Then by 16 weeks, you have to do all these tests to rule out any congenital anomalies in the baby. Then follow what I told before. You have to screen for your high blood sugar by challenge test. That is during the first visit, after 24 weeks, and also by 36 weeks. And definitely you have to have a frequent antenatal visits.
And lastly, when is it necessary to have a cesarean section?
It is not necessary to have a cesarean section. God does not has allowed all the necessary anatomy there in the birth canal to have a normal vaginal delivery. But it's all become a problem when you are not healthy. Your pelvis is not sufficient to allow the baby to pass. If you are overeating and if your baby has grown oversized, as I mentioned before, then you may not have a normal delivery. But if you are having a planned pregnancy and if your gain in weight is controlled and you are having a normal healthy pregnancy period, you can have a vaginal delivery. And vaginal delivery has to be sought because that is the natural way of delivery, and it's better that you go in for a vaginal delivery. But of course, only in emergency cases and certain indications for which the gynecologist advise you, alone you go in for a cesarean.
Doctor, thanks a lot for being a part of our program.
Thank you.
So that was Dr. Sheela C Babu with us. Until we meet next time, this is me, Naina, signing off. Take care.